Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back David Cundiff, physician, author, and healthcare reform advocate. Today's Kevin MD article is Accountable Care Cooperatives, a 2026 vision for U.S. healthcare. David, welcome back to the show.
Thank you very much, Kevin.
All right. So last conversation, we talked about accountable care cooperatives. Just to recap, just give us a brief definition of what that is, and then we'll talk about the Kevin MD article today.
Okay. Accountable care cooperatives. I introduced in my book, Grand Bargains, Fixing Healthcare and the Economy in 2015. And now is the time that we have a crisis in healthcare spending. And so it's the time to look at this option because other options are just not workable. So that accountable care cooperatives are what I've defined as private, non-governmental, although they're funded by the government. They compete, but they're self-regulating. And they also take care of social services, such as nutrition, housing, and employment for patients that are in the accountable care cooperatives.
All right. So tell us about your most recent Kevin MD article extending that conversation. What's this one about?
As of January 1st, 2026, we're in a healthcare crisis in the United States like never before. And my book, Money-Driven Medicine, Tests and Treatments That Don't Work, reported back in 26 that 40 to 50% of the costs of medical interventions were unnecessary or harmful, wasting about $1 trillion in 2007. From 2007 to 2025, we've spent roughly $35 trillion in ineffective or harmful treatments, more than the entire United States gross domestic product in 2025. We're literally bankrupting the country to pay for medical tests and treatments that don't work. This huge waste accounts for polls showing that medical system earns a D+ grade for affordability among the public. Out of roughly 18 million healthcare workers, only about 9 million treat a patient. The rest are administrators. Back in the 1970s, when I was in training, 1 out of 40 healthcare workers was an administrator. Now it's 1 to 1. And medical bureaucrats that don't see patients average about $108,000 a year. Frontline workers in healthcare that see patients get $87,000 on average. This may account for why 55% of our clinicians are considering or planning to quit. So what are the options going forward?
So before talking about the solutions, how do we get to this point? You said that, just to quote one of your statistics, we've gone from 1 administrator for every 40 clinicians now to a 1-to-1 ratio. How do we get to that point where now we have so many more administrators?
Well, it's very complicated. Good question. And I can't say that I really know the answer other than there's been a continuous increase in the cost of healthcare, and the government has just tried to throw strategies to reduce that increase. And they do it by just throwing administrators in there. So there's they're checking the Medicare, everything that's ordered from Medicare, and what's having Washington D.C. or other government employees just try to do things that reduce the costs of healthcare. And it's obviously not working because the cost of healthcare continues to just balloon.
And you're saying it's not just the government, but of course, health insurers also have this administrative bloat. And a lot of it is just because of the way our healthcare system is structured. A lot of the rules and payment structures that we have requires a lot of administrators to execute them.
Exactly, exactly. Yeah, and the what are the options going forward? Well, there's a Republican one big beautiful act, and what would it do? Well, it would increase healthcare costs. It's now 6.3 trillion in 2026, and it will be 9.6 trillion by 2035. That'll increase the federal deficit 3.4 trillion by 2035. And that's favored by just 41% of voters. Now, the Democratic public option has an effect on the federal deficit that's neutral. It won't reduce the deficit or increase it significantly. And 31% of adults favor that. The Democratic single payer Medicare for all that I remember back in 1990, I don't know if it's ever favored by more than 50%. It would supposedly reduce deficit by 2 to 5 trillion by 2035, but 35% of adults favor it. So all of these options, Republican and Democrat, are just non-starters. We need a different system. My book, Grand Bargains, Fixing Healthcare and the Economy, came out in 2015, and it introduced the accountable care cooperatives that we're talking about.
So I'm looking at some of the suggestions that you make. Number one is flip the ratio. You want to transition 5.5 million workers from administration back to the bedside. And another idea you have is to cap the panels. You want to move from 2,000, 3,000 patient panels PCPs have down to 6 to 800. So let me ask a question about that specifically. How do you propose flipping the ratio? A lot of these administrators don't necessarily have bedside training. How can we flip some of them and transition them to bedside care?
Well, we wouldn't necessarily make an administrator without medical training, train him to be a healthcare provider. But our system now, Medicare pays for interns and residents to go through their training, and that the money that they're using is very constricted because they have other things that they're doing with Medicare money. So we're just not training enough healthcare providers. I mean, since I was started in medical school, about a quarter of our physicians in the United States have immigrated from other countries, a lot of developing countries and developed countries. Why should we be drawing in physicians? I mean, they're great physicians and healthcare providers, but why do we need to draw them in rather than produce our own providers and finance that training? Accountable care cooperatives would do that.
So let me ask a second issue about capping the panels. Wouldn't capping the panels from say 2 to 3,000 to 6 to 800 worsen the primary care shortage when we already have difficulty finding primary care physicians for all the patients?
No, I think we could, well, already probably most primary care providers are nurse practitioners or physician assistants. And we could increase those numbers pretty rapidly. It would take some time, but we've got a lot of very bright young people in the United States that are interested in healthcare careers that aren't going to burn you out like the current system. And so we could do it.
What will be the first steps that you would implement? You did mention that both the Republican and the Democratic solutions are non-starters. If you were the healthcare czar and in charge of running healthcare in our country, tell us the first steps that you would do to implement your vision.
Well, the first step would be to get rid of all public and private insurance schemes, Medicare, Medicaid, veterans, Obamacare, children's care, Indian care, all with their own administrative bureaucracies, and those people count as in healthcare providers. We don't need that incredible amount of bureaucracy or bureaucrats. We need more healthcare providers. And yeah, it'll take some time, but if we start now in 2026 with a bill through Congress signed by the president, it could happen as an emergency. As when the Second World War was declared an emergency, things happened very immediately. And this is as much an emergency right now in the United States as any of the other emergencies going on, probably more.
Now, short of a world war, right? Realistically, what you're describing probably isn't going to happen politically, of course, right? So, is there anything that administrations can do currently? Of course, we have a Republican administration, and even if we had a Democratic administration, what do you think are some realistic things that could happen given the constraints of our political system?
Well, I don't know if I agree that the politicians are we're looking at our politicians in this regard as and regarding healthcare. I would rather go directly to patients and influencers like yourself about accountable care cooperatives. The politicians will listen if patients and influencers if this gets into the conversation. I'm confident that the politicians may be the last to hear about it, but they will hear about it if it gets into the conversation in the newspapers and media.
Another suggestion that you have in your notes was freezing the budget, right? Locking in healthcare spending at 6.3 trillion for 2026. Again, politically, how feasible is that?
I think it's more than feasible, but it has to be done by getting rid of all public and private insurance. That's so much of the cost of healthcare. So it would all come out of that, and there'd be plenty left over because the United States healthcare system costs twice what the next most expensive healthcare system per capita in the world is. So there's a lot of room there to save on the cost of healthcare while we're giving much more health care and also long-term care and most importantly preventive medicine. And then these accountable care cooperatives will be competing with each other, not on who can gain Medicare or other insurance companies, but they'll be competing with each other on who can be the most innovative in their preventive medicine and treatments to satisfy their patients, also keep the costs within control.
Now, with any significant change like the one that you're proposing, there's going to be winners and losers. If we're talking about dismantling entire industries like the private health insurance industry, there's going to be a lot of resistance. People are going to lose jobs. Companies may go out of business, right? So how do you overcome some of that status quo?
Yeah, with any meaningful change, for sure, there are people that are making great money. The insurance company is and the pharmaceutical industry, other industries that are connected with healthcare are cleaning up, and they won't necessarily like it. But I don't know if they all won't like it. I think they have healthcare problems too. They have children and grandchildren and see that the system is not working. And so I think that if people see this option and see, how bad the system is now, that this will win in polls, and the politicians will hear people that have read about accountable care cooperatives.
We're talking to David Cundiff, physician, author, and health care reform advocate. Today's Kevin MD article is Accountable Care Cooperatives, a 2026 vision for U.S. healthcare. David, let's end with some take-home messages that you want to leave with the Kevin MD audience.
It's up to Americans to look at this once in a multiple generation opportunity to do what I think maybe it was Truman, tried to do, change the healthcare system, and then Obama, and there were several in between, and they failed. Doesn't mean that this one will fail. I mean, it's because of all the previous failures, this one is the most consequential. And so I ask you to look at the Kevin MD articles I've written on this and the references it leads you to, and contact your politicians and friends.
David, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you so much.